Thank you. Good afternoon. Okay, where to start? So, like the other groups here, we are so happy to see the Kucinich Amendment because we recognize in Maryland that we've got to pass single payer, ideally at the national level, but if it has to be, we'll do it at the state level. It's really a matter of life and death. And in Maryland in 2006, a study showed that at least one of our residents between the ages of 25 and 64 was dying a day simply because they didn't have access to health insurance. So I take that to heart. So let me talk just a little bit about our movement in Maryland because we're much newer than the others. We've had kind of a basic, it was called the Maryland Universal Health Care Act for a number of years, but it really wasn't being pushed very far or didn't have a strong movement behind it. But what we did, I left practice about 2 years ago to do this full time because I felt like if we were going to make a change, if I was going to make a change, I needed to really devote my full energy to it. And so we had some sessions last fall and in the winter where we brought people together in various communities around Maryland, and we had kind of a draft of what we thought would create a health system in the state of Maryland that would actually deliver health care to every person and improve our health outcomes. And people were welcome to come. These were open meetings and give their feedback and tell us what they thought. And this was what I really thought a true health debate was, right? Where you actually have people come and talk to you and you listen to them and you make changes based on what they tell you, which is very different from what, unfortunately, we're seeing here in Congress this year. As a result from that, we wrote a bill that's called the Maryland Health Security Act because we believe that this is really what it's about. It's not just our individual security, knowing that when we wake up in the morning, if we get sick, we can get health care. But it is really a matter of public health security because the only way we're going to control infectious diseases in our state or our country is if everybody has access to health care when they need it. And this is I'll get off. I don't want to diverge, but that's an important thread. So why do we believe this is so important? You've heard everybody speak about their movements, and I want to just go a little bit about why, from a physician perspective, this is so important for me. Because it is about education. And each one of us needs to know how to speak when we go out, because it's not a partisan issue. We should be speaking to everybody about this. These are just plain facts and medical issues. The reason we support this is that it's truly universal. Every person can get health care. How am I, as a physician, if a patient shows up to my office, supposed to decide which one of them I can treat and which one I can't? I can't make that decision. If somebody needs health care, I want to give that to them. It provides continual health coverage. How can we allow people to go through periods in their life where they can't get health care when they need it? It's wrong. It doesn't serve us as a society well. It doesn't serve the patient well. They're going to have worse health outcomes, and we know that. It removes the financial barriers to care. So often in my private practice, patients would show up at the door and they wouldn't have the money to pay their copay. And we were struggling to stay afloat as a primary care practice. You really do struggle to make it these days. That brought us to a real dilemma. Do I say, I'm sorry, I can't see you because you can't pay your copay? That gave me a real visceral bad feeling. But at the same time, I know that we have to pay our staff and we have to pay our rent and we have to pay our electricity or we can't see anybody. So this removes those barriers. It also ends medical bankruptcy, as you guys probably know. 62% of bankruptcy, at least 62% of bankruptcy in this country is because of medical debt. And 78% of those people who went into medical bankruptcy had health insurance. Health insurance doesn't mean anything in this country right now. It ends that. It allows free choice of provider. One of the most heartbreaking things for me was to see a child go, visit them on their first day of life in the hospital and watch them grow up, and then because their family changed jobs or the employer changed insurance or the insurance changed networks, I can't see them anymore. That makes no sense to me. I know this family and I know this child, and I would like to continue taking care of them. It allows patients and health providers to make the medical decisions, not insurance administrators, who I consider to be practicing without a medical license, when they tell us what we can and cannot do. And finally, this has been covered, but this is the only financially sustainable way to finance our health care. It's the only reform that has built-in cost controls that are on a rational basis. a rational allocation of resources, not cutting Medicare, not cutting Medicaid. It's about figuring out how to use our dollars efficiently and meet the needs of our population. So in Maryland, when we introduced this bill last session, we run into all the political obstacles that everybody runs into that we're learning about. That they didn't release the bill until 2 days before it was due to be dropped. So we had 2 days to get co-signers. Does anybody want to guess how many co-signers we got in 2 days? We got 32 co-signers in 2 days. So I really feel like this coming year, when we'll be able to submit it earlier and hopefully get it earlier, that we'll have a better ability to get more people to co-sign. And we've been meeting with the heads of the different relevant committees. We've been meeting with Republicans. We met with the minority leader. We're not afraid to meet with people and talk because we're just giving the facts. It's about providing health care. So we're working with the chair of the Health and Government Operations Committee. He's doing a summer study. He's including us in that. We're hoping to do a pre-session briefing this upcoming session. We're working on getting the economic study. We already had an economic study in the year 2000 that showed a savings of about $350 million to the state if we enacted single payer. It showed that families would pay less, businesses would pay less. So we're optimistic that when we get this next study, it will also be favorable. So I just want to close on the fact that like many of you here, if we need to pass single payer at the state level, that's what we'll do. The current bill is not addressing our fundamental problems with healthcare in this country. It is not a solution. As a physician, I cannot support that bill. It's like offering a treatment that's not effective to my patient, and I won't do that. So I hope that if the bill does move forward, and that's out of our control, that the Kucinich Amendment stays in. I think we should do everything to keep it in there. But ultimately, this bill is not going to address the same problems, and we've got to continue to grow our movement and educate. And one day we will get there. I don't have any doubt about that. So thank you very much.